Hello everyone, my name is Yasmin Marjorie Kate Andres, a BSN student. So I will be your student nurse for today. So for today, I will be assessing the head, eyes, nose, ears, mouth, and neck assessment. So first, to make sure close any curtains to provide us privacy and also perform head hygiene. So the next step is to identify the patient and also to introduce ourselves. So, Mom, I'm Jasmine Marjorie Kate Andres from BSN 1H. So, what is your name, Mom?
My name is Crystal May Ikagsawa.
So, Mom, I assess your head. It includes your eyes, the nose, the mouth, and the ears. Then also your neck, nipple, and then throat. The next po is to assess the patient head. So, it includes the hair, this school, and the school. So, ma'am, okay lang po ba na hawakan ko po yung hair nyo?
Okay lang po.
So, I observed that there is no Alicia, not all, and so it's called Amanda is no dandruff, and also any sign of altophia as well. So, okay naman po. So, I'm gonna palpate her head. So, ma'am, okay lang po ba na hawakan ko po yung ulo nyo?
Hindi po.
So I observed that the head is round, symmetric, and then also head is so it's normal. So the side of the head also seems to be normal. So okay naman po. So now I gonna proceed assessing the patient face. So I can see here that her peripheral feature is anormal and symmetrical. So smile ka po. Smile ka lang po. So I can see here and I cannot observe that the left and the right is normal and symmetrical as well, and then there is no doffing of face, so normal. So after assessing the patient face, now we will gonna assess her sensory function. So close your eyes. Close your eyes. So, mom, may nararamdaman ka po ba?
Wala po.
Nung linas mo po yung eyes mo, may masakit po ba?
Wala po.
So, next, we need to check also the patient corneal reflex. So, I observed to ting, nung chinek ko yung corneal reflex niya, is nagbit siya. That is normal. So, the next thing to do is to assess the patient motor function by doing this. Yung parang kumakain. Okay na, okay po. Ipapatik. So the next thing to do is to assess the patient motor function by doing this. Yung parang kumakain po. Okay po, ma'am. May papatikim po ako sa inyo. Sabihin niyo po kung nalalasahan. Okay po, smile ka lang po. Okay po. So, normal naman po kasi lahat ng pinagawa ko is nagawa niya. So, normal siya. Sa pagkagat, nalasahan niya din po yung pinalasa ko po sa kanya. So, after assessing the patient face, we're gonna inspect the patient eyebrow, eye, and the eyelashes. So, we'll be needing a gloves to avoid contamination and any infection. So, I observed that the eyebrow is evenly distributed and also is symmetrical and aligned with each other as well as the eyes. So there is no presence of established fuzz and the eyelashes is turned outward and evenly distributed as well, so it's normal. So also sa eyebrow, wala naman any lesion at all of. So okay, normal naman po. So next is we're gonna proceed by palpating the cranial gland by doing this. So next is we're gonna proceed by palpating the lacrimal gland by doing this. So it seems to be normal and there is tenderness or swelling at all. So next is I'm gonna touch the nasal criminal gland. So there is no pain at all and any presence of swelling, so it's normal. So the next is we're gonna check the patient conjunctiva. So I observe the conjunctive as pinkish as color and there is no any foreign object and any types of swelling. So the conjunctive as the patient conjunctive is normal. So the next is we're going to check the scarria and the cornea. So the next we're going to check the scarria and the cornea. So I observe there is no abnormalities both left and the right. So this is the cornea and the cornea as normal. So the next is to assess the patient eyelids. So the next is to assess the patient eyelids. So the eyelids color is brown and the both side of the right and left iris it is the same size. So both left and right, so it's normal. So the iris size should be 10.2 to 13 millimeter in diameter. So okay. So next is we're gonna assess for the purple constriction by using a pen light. For now, I don't have a pen light, so I'm gonna use alternative. So we need to dim the light as well as now. Just gonna check the pupils constriction. So tingin ka lang po. Yung pupil niya nag-constrict, so I should be So, in a constrict, so normal. So, the next is, will be check the pupil accommodation. So, tingin ka na lang po, tingin ka na. Ay, tingin ka na lang dito sa bibig ko. So, ilawan ko dito, okay lang? Okay, yung pupil ni patient as a light each pupil. So, next is, so the next is, eto, tingin ka lang dito, right? Tingin ka lang. Isa pa din lang yun. So, my findings about the pupil is normal naman po. Wala naman akong nakitang any abnormalities when I check the her pupil, so it's normal. So next po is I gonna check the cranial nerve to the optic nerve. So for this, well, gonna tells the visual OPT, the patient using the nylon chart. Since wala naman po akong nylon charts, so ang normal findings is 20/20. Then pag hindi na po malinaw yung paningin ni patient or like blind na po, ganun. So, abnormalities na po. So, next is, iti-check po natin kung yung peripheral vision while doing this. So, ganito. So, ganito. Tingin ka lang dito sa isa kong mata. Wala. One kasi. 1, 2, 3. Okay, dito naman po sa kabila. 1, 2, 3. So, okay, so sa super television kanina ni patient, when I check, I observed that there is no present. Okay, so the findings is normal. She can identify kung ano yung pinakita kong number. She can identify kung ano yung bagay, yung pwede kong ipakita sa kanya left and right. So, the next thing to do is, okay, just need to follow this without moving. Without moving, okay, ready? So, okay, ilalapit ko pa sa ito. Okay, so I observed that there is no dirty movement at all and any shaking, so the findings is normal. So, what I've done earlier is to check the cranial nerve 3, 4, and 6. So, to check the cranial nerve 3, 4, and 6. So, the next is to assess the ear. So, now I can assess the patient ear. So, inspect ko po yung ear size, appearance, color ng ear ni patient. So, I observe that the ears are in a line with each other, both left and right, and also the color is perfectly fine, and also the size, so I did not see any type of lesion as well. So, okay. So, okay naman po siya. So, next is we're gonna palpate the oracles and the Mustrad forces, and now I'm gonna palpate the patient articles and mastery process. So, I observed that there is muscles, there is no swelling at all. May masakit man nung hinawakan ko yung tenga mo?
Wala po.
So, it seems to be okay because there is no pain at all. So the next, we're gonna palpate the tympanic and also inspect for deficient ear canal. Sabihin mo kung may masakit, mama. So I observed that deficient ear canal is fine. So I did not see any foreign object or as a sermon discharge. So it's normal. And wala naman po ako nakitang any rashes, swelling, or kaya lesion sa ear niya. So normal. To assess these, we're gonna check the nose symmetric, the face is the midline, so it's normal. And also, there is no deviation, so it's normal. So I see that the septum and the nostril are okay. So ngayon, I palpate or costal po natin over the frontal and the maximal innocence. So ngayon ay palpate or costal po natin over the frontal and the maximal innocence. So I observed that the frontal and the maxillary sinuses is normal since there is no pain or any swelling at all. And now I'll check po natin yung cranial nerve deficient. And now I'll check po natin yung cranial nerve deficient, which is the factory nerve. May ipapaamoy po ako sa kanya kung ma-identify niya to. So I observed the patient factory nerve is okay. So now I'm going to assess the patient mouth. So now I'm going to assess the patient mouth. So I observed the patient mouth symmetrical both left and the right, and also the mouth is perfectly fine. I did not see any edema or lesion at all and no bleeding. And then I'm going to touch the lips. I'm going to touch the lips as well so that the lips are soft and smooth. And then, ngayon, i-check po natin kung temporal labial patient. So, ngayon, check po natin yung temporal labial joint ni patient. So, okay naman po. Wala naman po akong nakitang tenderness or swelling. So, okay siya. Normal siya. So, ngayon, check po natin yung gums ni patient. So, i-check po natin yung gums ni patient. So, sa gums ni patient are pinkish in color and I did not see any swelling or masses at all. So, it's normal. And then, ngayon, check po natin yung teeth ni patient. So, I observed the number of teeth is 26 and the color is dominant color is white, so it's normal. And then the next is we're gonna check the tongue. So we're going to palpate. So hawakan ko yung tongue niya. Bilang. Sa galirong. So according to the patient, there is no pain at all and I did not see any swelling also. It's normal. And now we're going to check the overall. Sabihin mo, So, okay, when the patient do that, I observe that when she says, and there is any abnormalities and wala naman din akong nakitang swelling na nangyayari sa loob dun sa overall. So, normal. Wala naman po tayong mga abnormalities sa ating teeth, sa tongue, and then sa gums. So, the teeth po, pag minsan nagkakaroon na po tayo ng adhesion of the teeth o yung the session of the gums, and meron din po tayo yung sa may adhesion of the teeth, and then erosion of teeth, and then sa gums natin pag nakita tayo ng swelling or yung parang namamaga sa may gums, considered as abnormalities. And now we're going to proceed for the assessment of the neck. So we'll to palpate the posterior curvinal lump nodes by doing this. So, and now we're going to proceed for the assessment of the neck. So, we're going to palpate the posterior cervical lump nodes by doing this. So, gagawin natin siya. May masakit ba nung hinawakan ko yung... And now inspect for the front and the back of the ears as well. So I observed that time is no pain at all and also a presence of swelling. So the findings issue also want to palpate and inspect the under the chain of the patient and also the entire triangle of the neck, and later we're going to inspect the palpate also the face artery but one at time, and also the thyroid gland. So first is under the chain. And also the thyroid gland, so first is under the chain. So, ma'am, may masakit ba dito? Next is dito naman po sa may anterior triangle. So, ma'am, may masakit po ba dito? So, the neck is inspecting for muscles, so there is no swelling at all. And there is no pain as well, and the next is the carotid palpate one at a time. We better too. So the next is the carotid palpate one at a time. We who's better use a stethoscope to to do this, and also the thyroid gland, gland. So I observed that there is no abnormalities or any masses or swelling. So there is no pain as well. So it is normal. And wala din akong nakitang enlargement of the neck. Kung makikita man po tayo at may mararamdaman sa parts dito, ibig sabihin considered na abnormalities enlarged as occulted na thyroid gland using the valve of the stethoscope. Also, we need to inspect and palpate a supraclavicular and palpate the supraclavicular area of the neck, also as the patient. If there is any discomfort, pain, to identify the abnormalities and the normal. Masakit ba dito? Hindi po. So, according to the patient, there is no pain at any discomfort, so the findings is normal. And now we also want to assess the patient ability to move her neck by the chin to crack. And now we also want to assess the patient ability to move the neck by the chin to crack, and then the tip of the hand for as possible, and then each shoulder, and also each ear corresponding to the shoulder. So for example, again, okay, so relax. So, observe, wala naman po akong nakita o narinig na kami movement kapag ginagawa niya. According to her, walang pain, so the findings is normal. And sa ear naman, we also want to check or assess the muscle strength of the patient by doing this. And then sa ear naman, we also want to check or assess the muscle strength. Ear. Yes. And also, I want to check the muscle strength of the patient by doing this. Again, this is to determine the strategies, its strength to the findings is normal. So that's how we demonstrate head and neck assessment. So after we do all the assessment performed and height hygiene. Thank you.